Every year, more than 120,000 babies are born with birth defects. Now, a study shows taking prenatal vitamins is often very effective in preventing birth defects.
Yes, so we have Dr. Denise Lochner here tonight to talk more about how to prevent birth defects. Now, first off, these prenatal vitamins, why is that so important and what do they actually do?
Yes. So prenatal vitamins have many different, obviously, vitamins that are important in the nutrition because a lot of women don't have a very healthy diet. One of the important things to take is folic acid. So it's very important that your prenatal have at least folic acid of 400 micrograms. And what that does is that's been shown to reduce the chance of a condition called spina bifida, which is an opening in the spinal cord.
Sure. But that's just one of the vitamins. There are so many others,
Exactly,
right?
exactly.
Can you tell us about some of the others?
Yes, and so, some of the other things that are very important in there is iron supplements. Because a lot of women become anemic during pregnancy, and if she becomes very anemic, it not just affects her, but it also affects her unborn child.
Okay. So, other than taking vitamins, there are many other things that a future mom needs to do to prepare.
Absolutely.
And we've often heard that moms can get prepared before they become pregnant.
Correct. And so a few things that she can do would include making sure that she's reviewed her medical history with her physician and that her medical conditions are under good control. There's a lot of medications that they can take that could actually be harmful to the baby. Some of the blood pressure medications can actually cause birth defects. And in addition, if she's a smoker, stopping smoking is also very important because that's not just harmful to the mom, but it actually affects the baby as well. Excessive alcohol use can cause problems.
Sure.
There's some genetic family conditions that should be reviewed. And of course, if she's had problems with a previous pregnancy, that should be reviewed as well because that can also impact a future pregnancy, and there's things that we can do to prevent a problem.
Okay, well, we are going to talk to you more later in the show, so thank you very much. And we're going to be talking about how diabetes can affect those birth defects.
Absolutely.
Absolutely. It's very prevalent here in South Texas. We need to talk about that.
Thank
Dr.
you,
Lochner, we'll see you in just a bit.
Okay.